this video, I am going to demonstrate a Foley catheter insertion on a male patient. So to begin, you're going to want to verify your order from the provider and making sure that order is appropriate for your patient. So some indicators that a patient needs a Foley catheter is that they're experiencing urinary retention, they're coming in or out of for surgery, or they have a spinal cord injury. Next, you're going to want to go into the patient's room, introduce yourself, and verify the patient using two patient identifiers, their name and their birth date. Next, you're going to want to verify that information using the patient's wristband. So next, after we verify the patient, we are going to explain the procedure that they are getting a Foley catheter inserted. Next, if there's any family members or visitors in the room, we're going to kindly ask them to leave to give the patient privacy and to keep their dignity. So once we explain the procedure and ask the patient's visitors to leave, we are going to use hand sanitizer to perform hand hygiene and putting on some clean gloves. Once we have our gloves on, we are going to raise the bed to an appropriate level. Then we're going to lower the bed railing. We're going to want to make sure our table is wiped off using a sani cloth. This is where we're going to put our sterile field. Now we are going to uncover the patient. Making sure all the covers are going to be away from the sterile field. So before we open our catheter kit, we are going to perform peri-care on our patient. So once you prep your table and perform peri-care on your patient, you can prep the sterile field. So we are going to open our kit. So we are going to open away from our body. We have a 1-inch border that we can use to move it around. And I like it so there's no hangover. So in our kit, we have a pair of sterile gloves and this drape that we are going to be putting under our patient. So we can open this up. Stick this under our patient. Now we are going to change our gloves, put the sterile gloves on. So there's a left and a right one. So the first one that you're going to grab the inside of the cuff, they're going to be folded. Just slide your hand in, making sure not to touch the outside of the glove so you don't contaminate it. Next, we are using our hand, we are going to slide it under like this. Slide our hand in, making sure not to touch the inside of the glove. So then we are going to pinch the middle of the paper that our gloves came in, and we're going to discard it into the trash, making sure not to go below our waist. If you go below your waist, you're going to break the sterile field and you'll have to start over again. So in our kit, you'll have some cleansing swab sticks. I switched these out for the stimulated swab sticks to use on our mannequin. Then you'll also have some lubricating jelly. Then for the lubricating jelly, I'm going to use this silicone oil. So now we are going to prep the field, making sure our swab sticks are available. Put this in here. Now to open the Foley catheter, we are going to want to coil this in our hand. That way it doesn't go all over the place, breaking the sterile field. Now we are going to drop this in the garbage. Then we are going to put our syringe on the Louis lock. So before we can insert the catheter, we are going to use the swab sticks. I'm going to spray this silicone oil on our tray, putting our catheter in it. So here's our swab sticks. I am going to grab the shaft and using the swab stick, I'm going to go around once. And you don't want to put this back in the sterile field. You can either set it on the bed or put it in the trash. I'll grab my other two here. Go around again. Third one. Go around again. Now, you don't want to let go of the penis. Otherwise, it could touch the inside of the leg or anything like that. So you're going to grab the catheter, set it on the sterile field, and then with the end, you're going to wean it up there until you see a flash of urine go into the tube. So we're going to inflate the balloon. And once that balloon is inflated in our patient, we'll take the empty syringe, discard of it, and then with our drainage bag, we're going to secure this to the patient's leg first, and then with the drainage bag, we'll put this on below the bladder on a part of the bed that doesn't move around. So we don't want to hang this on the patient's bed railing. And so now to discard of the catheter or to discontinue it, put this like that. We will grab an empty syringe, put it on that Louis lock, hold the catheter place. We're going to get that saline back in the syringe and to deflate the balloon. So the balloon is deflated. Some people like to ask the patient to cough while we take the catheter out. Okay. Then we would discard of the catheter in the proper container. Perform peri-care after the catheter has been discontinued. Clean our patient up. Cover our patient back up. And then see if the patient has any questions at all. Get the railing back up. And then we'll lower the bed. And then with charting, we want to chart our output and then the color of the urine or if there's any odor to the urine as well. Then perform hand hygiene and this activity is done.